I think one of the things that certainly newer BCBAs sometimes confront is they're very idealistic. You go into this field for a reason, and they come into a classroom or a school and they want to change the world. And I think, Brett, you made a comment about something like small wins or something like that. That not only just the pairing, but sometimes they might want to redo the whole classroom, or they see problems everywhere. Right. Yeah. And if they go for more of a small win and get some credibility right there, you just have to exercise some patience, and that can be hard if you're just got past your exam and you're all set to go and everything else.
So your point, I guess, is just don't try to change a whole bunch of things at once. Probably try to pinpoint what is the learner and the teacher's biggest pain point, probably. And I think when it comes to a teacher and possibly the pairing part, what I remember doing is trying to do anything that would lighten the load in the beginning for the teacher. Teachers in general are not paid for their performance. They're paid for the years they put in and for being able to get there on time and be steady. They're not necessarily paid to work at 150% speed all the time. Yeah. And they may have learners in that classroom that are having them at 150% speed constantly due to maybe darting out of the door or it could be as major as self-injury. And to me, what I've noticed is the moment that you can take the burden off of them for a short period of time is the moment that you may be able to get some buy-in, because they need breaks, or at least they would, when you ask permission, hey, do you mind if I get hands-on? Yeah, do you mind if I just impact the small area of the classroom, this one learner? And when they give you that permission, as opposed to what I said earlier, just jumping in, you get that permission, you get that buy-in, and you start changing behavior. I think what you see as a teacher that right away is like, oh, this person's here to help. They just made my difficult week on a Friday that much better.
Yeah.
So,
and a lot of times too, like for the clinicians that are making that difference and stuff, if the BCBA comes in and there's like any kind of headbutt, then it's the person who's doing like the daily work. Every time they come in the classroom, they're like, oh, this person's coming in, they're gonna tell me what to do. I don't want it.
There's been so many times I've come into a new classroom and, like you had said, lightening their load. Basically saying, I'm yours for this amount of time. Push me around however you need me to be in the classroom. Even if it's just passing out papers or sitting with a specific student, I'm there to assist in any way I can. It doesn't have to be that pigeonholed, sit in the back of the room and take notes. Yeah. Be present in the classroom and help as much as you can to build that rapport. And you brought up a great point as well with the jargon. I know it when you're in your program, you're collecting your hours, they push, knowing the terms. But when you step foot in the classroom, nobody really cares if you know the terms. Right. Nobody really cares if you could spit out all of the fancy jargon to a teacher.
7 dimensions, all that.
Right. If you spit that out to a teacher, they're going to go, look at this jerk. Mm-hmm. They're just talking to me about all this crap that I don't care about, and they're trying to be fancy. Just be real and honest with somebody and use regular language. A teacher will appreciate you so much more if you could be real with them.
Layman's terms.
And down to earth in the lamest terms, correct.
Yeah. And Brett, what you were saying about your people coming in and assisting with the class and allowing that teacher to get a little bit of a break and to help with those students, it all goes back to training those folks before they get into the school district, managing their expectations, right? As when we go in there, tell them really what's going to happen, right? Like you said, Beth, they're not going to change the world in 2 weeks, right? They're not going to come in and it's a war of attrition. It's little bits and pieces of progress. They know that you do the pairing, as the lady said, you pair that, you do that well, and then what you said and ran into is it's the approach and the style of the employee going in there and speaking to that teacher in a very professional way, but yet not in a threatening way, right? Or not in, I'm talking over you, right? Because I know this additional behavioral science, jargon that is helpful to students, but I'm there strictly to help you help this child as well. That's all your role is, right? I keep saying, know your role. And if you could marry all three of those things, then you have what you folks do, so well. Yeah. Better classroom management, better classroom techniques to assist in that management, make better learners, make more progress, right? And that's so difficult. It's so easy to say, right? But it's so difficult to do. But a point you said too is so right. I mean, if you do your job as well as you do it, you're out of there, right? And then you're on to the next district or the next classroom or whatever it may be. But I got to tell you, back to what you had said previously, that you put the blame sometimes on the BCBA for not being able to work that relationship. Trust me, I've seen some teachers, no matter how much you do, it doesn't make a difference. They're never going to buy in to a 27-year-old man or woman coming in there and telling this 55 or 60-year-old teacher who has 35 years experience how to teach the students in that classroom. It just won't work.
When it comes to that and the rubs when it comes to the consultation and someone actually listening to it. And then you brought up a good point about treatment integrity. I've heard at times that there are some schools that prefer that we don't take treatment integrity data on the behavior of the teacher implementing a behavior intervention program for concerns over union issues or us evaluating performance. Can you speak to that? Because
and that happens. It depends on the district, and it depends on the strength of the union too. Right? So if they have a really strong union who is by the book on that collective bargaining agreement that outlines terms and conditions of employment, and folks know as unit members that they can go to their union president or their union vice president or their building rep and say, man, I feel like they're actually evaluating me, right? Or they're making me do stuff that's not within my job description, and I'm getting an increase in what they call a workload during the course of the day, right? I'm doing more than I'm supposed to be doing, and who are these people to do that? So they'll run to the union, make it a union issue. Sometimes they'll file a grievance, and I'll say, well, what are you grieving though? It's not your employer that's doing that per se, right? It's the outside contractor that's working working collaboratively with you to implement an IEP or a behavior intervention or to do an FBA, whatever it may be for that child. It depends on the district. It's not frequent that I find it, but it's common. It happens.